Hi, this is Dr. Demestri. So thank you for this question. So this patient is BRCA1 positive, meaning that they have a very high lifelong chance of getting breast cancer. So these are the women who will often pursue a prophylactic mastectomy, so removal of the breast glands on both sides. Prophylactic meaning removing it preventatively. So before cancer has a chance to develop in the breast tissue, they say, let's get this breast tissue out and move on, get that peace of mind. So when you are coming to see me as a plastic surgeon, sometimes you've already seen a general surgeon, your mastectomy surgeon, and sometimes you have not. So the very first thing is determining that. Have you seen your mastectomy surgeon? If not, I can give you some recommendations for some, and then also deeming, are you a candidate for a nipple-sparing mastectomy versus not? So in the BRCA patient, from a cancer perspective, you are a candidate for a nipple-sparing, meaning there's no tumor close to the nipple, and there's lots of evidence showing that it is safe to leave the nipple in place. So that comes into play. Are you a nipple sparing candidate from my perspective? And my consideration for that is, where does your nipple sit on your breast? So if it's perky or perky-ish, then most of the time we can do a nipple sparing mastectomy. If you have big breasts that have some droop to them, the nipple's sitting low, and we want to reposition and lift everything, then you are not a candidate for a nipple sparing mastectomy. And instead what I do is take your nipple and areola as a graft and stick it on, so it can still look really good. Next consideration would be your options for reconstruction. So you want to find out if your plastic surgeon is a breast reconstruction specialist, and do they offer all of the options for breast reconstruction, including microvascular free tissue transfer? Are they offering the free flaps or the natural tissue reconstruction? So that's microsurgery. It's different from the implants, and you want to make sure that you are truly hearing about all of your options. So even if they do not offer that, you want to make sure that they can either talk to you about it or refer you to someone who can. Once you have gone through all your options, so just in very brief, that's going to be implant-based or natural tissue, then you can also inquire about how many surgeries does your surgeon anticipate for you. So most of my patients are looking at least 2 surgeries to reach their most aesthetic outcome. You want to find out, does your surgeon do their own revisions? Do they stop after the first surgery? Find out that information in advance. I think the time frame in between revisions is good to know as well, so that you can have an accurate picture in your mind of how long your reconstructive process is going to be. And then finally, it's useful to come in with some size goals. So knowing whether you want to stay around the same size, go smaller, go bigger. If you're looking to change the style of your breast at all, then it's also useful to come in with some goal photos. You can go on websites such as like realself.com, which have tons of patient posted before and afters, and already have them brought into your appointment, so your surgeon can give you an idea of whether this is a realistic goal or not. And then I also think it's nice to have an idea of what your post-op follow-up schedule will be, again, so that you have that all very clear, expectations are clear and met all around. Hope that helps. Have a great day.